Good morning, everyone, and welcome to this meeting of the Audit and Performance Committee of the Perth Kinross Integration Joint Board. I'll first ask if there are any apologies or substitutions for this meeting.
Thank you, Chair. Good morning, everyone. We have apologies today from Ms Bernie Campbell. We also have apologies from Mr Ronnie Erskine, and we have Mr Bob Benson substituting for Mr Erskine.
Okay, thank you.
Pat Kilpatrick has submitted apologies, and I'm substituting for her, Beth Hamilton.
Okay, thank you very much, and welcome to Beth. Okay, the next item of business is declarations of interest. Can I ask if any members have declarations of interest in relation to the items of business before us today? Just give that a few seconds. Okay, I'll take it as there are no declarations of interest. Thank you. Right, we move on now to the minutes. The first of which is the minute of the meeting of the Audit and Performance Committee on the 21st of June 2021. Are members happy that that's an accurate reflection of the discussion that took place at that meeting? I will take silence as yes. Okay, so if we can note that minute. The second minute is of the special meeting of the Audit and Performance Committee, which was held on the 2nd of August. Are members content that that is also an accurate reflection of the discussion at that meeting? Again, unless I hear otherwise, I will take that as noted. Okay, we now move on to the action points update. And I shall ask the Chief Financial Officer to speak to this report.
Good morning, everybody, and thank you, Chair. Yes, I'm pleased to note that we only have 5 actions on the action points update, of which I'm pleased also to say that 3 are now complete. Those complete since the last meeting relate to the fact that we held an IJB risk development workshop, which was well attended, and we now look forward to a further session around risk tolerance. The further action that was completed related to the agreement that the Chair would write to both partner bodies in relation to issues raised in the financial risk audit, and that has now been completed also with those letters sent. The further issue that's been completed relates to the audit of provider sustainability payments in relation to the cap. We've provided clarity for members today that actually the cap relates to advance payments, and there's only one advance payment that has been approved, and it was well below contract value. So good progress in completing recommendations. The 2 outstanding, as I say, relate to the risk tolerance workshop and in relation to briefing on sickness absence, which will be provided to members. We now have that information and be provided to members as part of the next Chief Officer's confidential briefing, which will be sent out in the next few weeks.
Okay, thank you very much for that update, and it's very good. Says that I had been muted, so I'll try that again. Thank you for that update, Chief Financial Officer. Very welcome to see some good progress in those areas. I, for one, thought the risk management workshop was very useful, and I'm looking forward to the following one on the risk appetite. I see Mr. Benson is wanting to come in.
Nothing to do with the action points. Just say, Chair, as I don't have a hands up option, so if you could look at me on screen when I put my hand up, that would indicate when I want to speak.
If possible, if you could indicate in the chat, that would be helpful, because I can't always see just the way that this is laid out, if that's okay.
Thank you.
Okay, thank you very much. Right, I'll ask if there are any comments or questions on the action points. No? Right, and then just finally, are there any matters arising from the minutes? Okay, right, well, thank you for that. If we move on then to the performance section of the agenda, and the first report that we have is the 2021-22 financial position report. And again, I'll invite the Chief Financial Officer to speak to this report. Thank you.
Thank you, Chair. I'm very pleased to bring forward the first formal year-end forecast for 21-22 following approval of the budget in March. First of all, members may have noted some changes to the format and content of the report. These have been made to simplify as far as possible a continuing complex financial position, and I hope our efforts to strengthen openness and transparency meet with your approval. Based on actual expenditure to the 31st of July, an overall underspend of £232,000 is forecast. For health, a break-even position is forecast. At this stage, delivery of a balanced budget relies on using only £833,000 of the £1.4 million NHS Tayside bridging finance, due to there being a far higher 2021 health underspend reserve than planned. Members will recall that our outturn on health was better than expected and has given rise to that increased reserve position. Discussions are ongoing with NHS Tayside around the potential application of the unused bridging finance, although NHS Tayside have indicated that it may be required to be passed back to offset NHS Tayside's forecast overspend on inpatient mental health. For social care, the £232,000 underspend forecast is being achieved without use of any of the £1.7 million reserves previously expected to be required. Additional £900,000 Scottish Government living wage funding was received at the very end of March, and that's had a material and positive impact on the 21-22 forecast. Over and above that, social care is forecasting an underlying £716,000 underspend, driven most significantly by a reduction in expected demand for care home placements, although this is being offset by an increased demand for care at home. For COVID, expenditure of £8.8 million is forecast, of which £4.5 million will be met by the IJB COVID reserve, and the forecast assumes that the balance will be fully funded by additional Scottish Government funding. A key meeting is due to take place this week with Scottish Government following a benchmarking of forecast COVID costs across Scotland. A number of financial risks have been set out in the report which may have an impact on the forecast moving forward, and in addition to those set out for this year, we've highlighted that for future years, slippage on the delivery of approved savings remains a significant risk for the longer term, with the capacity of the management team continuing to be focused on COVID response, remobilisation and contingency. In relation to earmarked reserves, the majority of those earmarked for specific use are expected to be spent. However, there is some slippage, and again the capacity of officers to take forward the significant redesign that is required to underpin the delivery of the outcomes expected from this funding is still limited. I'm very happy to take any questions that members have on the report.
Thank you very much for that, Chief Financial Officer. And just before we move on to questions, I'd like to say that I thought the key financial risks section was very useful, and I welcome its introduction following a recommendation from the internal audit recommendation, so that's very welcome. I'll move on to invite questions on this report, and I see that we have some questions from Mr. Benson, so we'll start with him.
Thanks very much indeed, Chair. I'm happy to have a response to each question in turn rather than read out all three questions, if that's okay.
I think that would be helpful if different matters.
Thank you very much. On page 23, I'm sure you'll be disappointed to note that only 260,000 out of 2 million savings has been achieved. Are there any new areas of savings being thought about or identified?
If I could come in first, Chair, and then pass to Gordon, who I'm sure will want to respond. I would just want to clarify, Bob, that, you know, of course, the financial plan for 21-22 anticipated that level of slippage. That was fully expected, planned for, and bridging finance has been put in place, and that reflects our acknowledgement around the ability of service colleagues to deliver whilst responding to a pandemic. But in terms of our ability then to look at other opportunities, again, that you know, falls into the same category of, you know, limited capacity to look at those specifically, although significant opportunities have arisen from the pandemic to look at you know, different aspects of redesign. But I'll hand over to the Chief Officer, who will, I'm sure, want to respond.
Thank you, Jane. Thank you, Chair. Good morning, everybody. Yeah, I think Jane's recognised the fact that we do have extant savings proposals that, as a result of the consequences of the pandemic, we've been unable to progress. I think those are framed in the context of our wider transformation plan, and given our experience over the last 18 months, we will have to quite forensically review the validity and the relevance and the affordability of some of the commitments that we had previously made through the lens of COVID-19. And probably also that lens will create other opportunities, and other savings may well be able to be brought forward. As you'll see from this report, the reduced demand at the moment for care home placements may be something that we want to try to sustain by delivering much more effective, comprehensive and robust care at home services, and actually give effect to our strategic ambition to shift the balance of care. So notwithstanding the demands of the continuing demands of the pandemic, I think it's probably fair to say that we're in the fourth wave, and notwithstanding the fact that we're still in emergency measures, particularly in terms of the NHS, over the coming weeks we would be intending to review and revise our previous plans and bring forward some recalibration of where we might not now make savings, offset against some new proposals that we would like the IJB to consider. So this is work that we're hoping to advance over the coming weeks, Bob.
Thank you, Chair. If I may move on to my next question. Page 24, and it also relates to the last line of the table in page 32, which is 2021 social care operational underspend. Can we have a bit more information on this, and why is this earmarked?
Who wants to take this one?
I'm very happy to take that question. I just want to be sure I'm answering the correct question that Bob's asking here. So I'm sorry, Bob, can I just ask you to clarify your question?
This is on page 24, and it also relates to the last line of the table on page 32. And I'm having to obviously work between different electronic pages here, but there does seem to be a gap in that area. I wondered if you could just clarify some of that for me. And it does relate to the social care operational underspend.
The social care operational underspend of 2.926 million was expected to be used significantly to balance the financial position. We expected to use 1.7 million of that to balance the financial position. That was the planned position. We're now finding that because of the living wage funding and because of the underlying underspend on the operational position, that none of that reserve is currently required. So that formally becomes unearmarked, but it's very dependent on how the financial position moves over the course of the year, because obviously we're dealing with a forecast rather than an actual position. So it would be imprudent to significantly consider using some of that for other matters, but we are, as a management team, absolutely considering how that may be used to pump prime transformation and change.
I'm very grateful for that, because obviously some of this relates back to the previous answer from the Chief Officer on spend to save proposals, and it would be useful to get an update at some stage on that as soon as we can, even if it's only in part, as I would expect. And finally, page 26, could you give me a wee bit more information on the 0.8 million Perth and Kinross share of mental health overspend? What does that describe?
Thank you, Bob. The NHS Tayside financial position includes and has done last year and this year a significant forecast overspend on inpatient mental health, and discussions with the Director of Finance, with the Chief Financial Officers of the 3 health and social care partnerships have led to a discussion around how we may help support the NHS Tayside with that position. And for Perth and Kinross IJB, the discussions have centred around the potential return of the bridging finance, should it not be required, to NHS Tayside to support their position.
Thank you, Chair.
Okay, thank you, Chief Financial Officer, and I'll perhaps return to that issue when we come to comments. Can I invite any further questions? I see we've got one from Councillor Duff, so we'll take Councillor Duff, and then if anyone else wants to come in, if you could let me know. Councillor Duff. Thanks, Chair. My question is around paragraph 4.2, which is on page 21. It talks there about application of a recurring surplus. I'm not sure, is that referring to table 2 above that? And if so, I see that under the third bottom line, it talks about PKC non-recurring funding of 838,000, which seems to contribute to that surplus, if you like. And if that's the case, how can it be recurring if that's a non-recurring entry? Chief Financial Officer.
Yes, absolutely. The recurring surplus position, which was planned, well, we expected a deficit. We expected a £456,000 deficit. We can see that in the approved financial plan column. However, we then received very late notification of additional recurring funding from the Scottish Government in relation to the living wage. Now, the costs associated with that funding had been fully built into our financial plan. And what that meant was that 900,000 could go straight to offsetting the underlying deficit position because it wasn't required for living wage costs. So it's transformed an underlying deficit to an overall recurring surplus. And the comment around the financial planning process moving forward is that we roll forward into next year with that recurring surplus. But clearly we've also talked about slippage and savings delivery, all other pressures that we're currently starting to forecast for next year. The underlying surplus is likely to be absorbed in the further pressures and underlying savings which may not be achieved. So we have transformed from an underlying deficit to an overall underlying recurring surplus, but our plans for next year will look at how that pans out. And that is a separate issue from the PKC non-recurring funding. It is separate non-recurring funding that was passed to us to meet transformation costs, particularly in relation to our complex care transformation, and that's expected to be fully required one way or another. So it's forecast to fully offset the position.
Okay, thank you. And if I could just highlight what I think is a typo at 7.3, Jane. On the third line, it talks about additional Scottish Government funding of 4.247 million. I think it should be 4.2 274.
I'll
Just
take your
for the
word for
record.
that, John, and apologies.
No, it's okay. I think it's better just to highlight it officially
Thank
for the
you.
record, as it were.
Yeah, much appreciated.
Okay, thank you.
Okay, thank you, Councillor Duff. Can I just check whether there are any further questions on this report? No? Okay. Can I invite any comments on the report? And while I'm waiting to see if there are any coming in, I just wanted to comment on the question of the bridging finance from NHS Tayside and the possibility that that could be used for the inpatient mental health overspend. I'd just like to put on record that I would be concerned if that were to be used for that purpose. While I do understand that it was given to us as bridging finance, the budget for inpatient mental health has transferred from Perth Kinross Integration Joint Board to NHS Tayside, and therefore I would be a bit disappointed if overspends were being dealt with through money that could be used in Perth Kinross to help transform care and shift the balance. So I know that the Chief Officer and Chief Financial Officer will be making the case for those monies to be used in Perth Kinross on those issues rather than to help the NHS Tayside budget position. But I appreciate that that might be a difficult conversation, but just to put on record my view on that. I see the Chief Officer has turned his camera on, so I don't know whether he wants to comment or... Yes?
Certainly, my camera's been on for a little while, so it wasn't specifically...
Sorry, on maybe.
No, but your comments are noted and certainly will inform the discussions that are taking place. And I note that your preference, your expectation in this regard would be to invest in local services, and presumably that includes in relation to our ambition to keep people out of inpatient hospital in respect of community mental health provision. So yes, thank you for those comments.
Okay, thank you, Chief Officer. I don't see any further comments on this report, so I'll just reiterate what the recommendations are. We are being asked to note the overall projected outturn after the application of reserves is at £236,000 underspend. Note the COVID-19 response and remobilisation costs are forecast to be 8.821 million. Of this, 4.587 million will be met by the IGB COVID-19 reserve. The forecast assumes the balance will be covered in full by additional Scottish Government funding. We're asked to note the update regarding the IGB reserves position for 2021-22 and note the financial risks that may have a future impact on the financial forecast against which mitigating actions continue to be identified. That was a very long recommendation, but are we content to accept those points and note them?
Agreed.
Agreed? Okay, thank you. Right, if we move on now to item 4.2, which is the key strategic performance indicator report for the period of June to June 2021, or quarter one of this financial year. I'll ask the Chief Officer to introduce this report. Chief Officer.
Thank you very much, Chair. So as you've indicated, this report covers the period up till the 30th of June. Members of the Audit and Performance Committee will recall that in the August meeting, the annual performance report was approved, covering the period up until the 31st of March. So the paper today provides details on our performance in relation to those indicators for which data is available up until that period of 30th of June. And we have sought to develop routine reporting to the Audit and Performance Committee and a rhythm to that. You'll see at the bottom of page 33 that further information is expected to become available when published to enable us to draw comparisons in relation to our relative performance in future dates and will be brought forward to future meetings. In terms of the overview relating to the information presented to committee today, you'll see that when compared to last year, 7 indicators have data now published, 4 of which are within the target range, 2 are over 3% out with the target range, and 1 is 6% over the target range. Those that, when compared to last year, I would wish to draw the attention of the committee to are outlined on page 34. The rate of emergency admissions per 100,000. We're seeing here that the performance is currently down from that achieved last year. I think it's probably important to reflect on the impact of COVID and the extraordinary pressures on us during the pandemic, including in relation to the extent to which the services that were operating and demands that were being faced last year are perhaps slightly different to those that we're now seeing. But in that regard, we can see that our performance, whilst it remains higher than the Scottish average. We're also seeing here increase in the numbers of patients who are delayed compared to last year. But again, performance remains significantly better than previously and above Scottish averages. There are currently significant challenges around delayed discharge, and those relate to the impact of the pandemic, the effects of non-COVID health services being reinstated, and some capacity challenges as a result of vacancies, as a result of staff being absent through illness and self-isolation. So those are particular challenges that we're currently seeking to mitigate and manage, and we're bringing forward various actions to seek to do so. In relation to the third indicator, accident and emergency attendances, we'll see that there has been a dip in performance, but again, our performance remains better than in previous years, and we don't have the data yet to compare to Scotland. That's inevitably a consequence of, as I say, non-COVID health services being reinstated and lockdown restrictions being removed, resulting in more accidents and emergencies presenting. If we move on, we'll see that we continue to have challenges in relation to emergency readmissions to hospital. Members of the Audit and Performance Committee will perhaps recall that there is significant work being done to data cleanse here. We have concerns that the way in which data is recorded here in Tayside is different to how it is recorded elsewhere, and we're looking to remedy that so that we have a more valid benchmark in order to compare performance. Similarly, we continue to have concerns about the data and the performance in relation to the numbers of falls. We're trying to get behind that because we have, we think, a very robust falls prevention strategy and significant activity that's seeking to mitigate the risks of people falling through our Care About Physical Activity programme and some of the work that we've been doing with Paths for All, which we did in the care homes and we're now delivering in care at home and heart services. So we will provide an update in relation to the outcome of that analysis of the data pertaining to falls as soon as we're able to progress that. It is quite technical and fairly labour intensive, and apologies that we haven't managed to progress that as yet. Moving forward, I've indicated in the report that we will continue to look at engaging with other health and social care partnerships in Tayside to be in a position where we can report on the relative performance of hosted services hosted elsewhere on behalf of the 3 IGBs and hosted here in Perth and Kinross. We will be looking to report into the other health and social care partnerships in order that they can apprise their IGBs of performance in that regard. And there's another couple of areas there that we hope to develop further activity in relation to, particularly significantly patient service user carer feedback, which is a work that we are currently progressing. Just to conclude, that performance at this early stage of the reporting year would appear to be relatively good. We are not at all complacent about that. We're looking at, as I say, both the activities that will be necessary to mitigate some of the challenges that we're experiencing that are having a bearing on our performance, and actions being brought forward to ensure that the data that supports that reporting is robust and valid and applied consistently with across Tayside and indeed elsewhere in Scotland. As always, I'm happy to take any questions in relation to this paper, and I think also Chris Jolly, who's with us today, may be able to support me in relation to any particular questions that I'm unable to answer. So thank you very much, Chair.
Okay, thank you, Chief Officer, for that comprehensive update. And just to touch on the point you made towards the end of that there, in terms of hosted services and also the patient service user and carer feedback, I think that's very welcome that given some of the comments that have been made at recent meetings from members of this committee and the IGB, that they are going to be incorporated into future reports, and also, as I think I said at a development session, but just for the formal record here, is my intention to write to the chairs of the audit committees in Dundee and Angus IGBs on that issue of information sharing. So that's something that will hopefully assist with those discussions. I'll invite now questions on this report, and I see that Councillor Duff has a question, so we'll start with Councillor Duff.
Thanks, Chair. A couple of questions if nobody else is coming in. First one is round about the delayed discharge, which I think is NI 19, and you know, whilst it's disappointing, obviously we're still performing well in terms of the national comparator, but I wonder, is this the case only in Perth and Kinross, or is it across NHS Tayside? Are delayed discharges being reflected there as well?
Thank you, Councillor Duff. Happy to answer that, Chair. Indeed, your point is well made. It is a pressure that has been experienced across NHS Tayside, particularly Dundee, and ourselves have increased numbers of delayed patients. But it's probably important to reflect that this is representing the national trend, where we are seeing significant increases across Scotland in the number of people whose discharge is delayed. And the Scottish Government has initiated a range of actions to look at what is necessary to support people's discharge from hospital and address those concerns. Particular focus has been given, Councillor Duff, to the capacity and availability of care at home, social care provision, and it's also the case that at any time there are a number of care homes that are temporarily closed to new admissions when there is a COVID outbreak or a suspected COVID outbreak. And at the same time as increasing demands are being faced by the hospital system, and probably also with people with an increased level of dependency and acuity, the services that are necessary to give effect to delays are significantly impacted by capacity issues. So we're neither an outlier in Tayside nor in relation to the Scottish system as it's experiencing those pressures currently.
Okay, thank you. And I don't see anybody else want to ask questions, so I'll just carry on with my second one, if that's okay. Under MSG3, when it talks about A&E attendances per 100,000 population, and our numbers have jumped up just by, I think, about 930, isn't it? I was reading somewhere recently that in order, you know, if you contact your local community hospital, you're directed to go through NHS 24, and I know that there are delays in perhaps getting a response through NHS 24, and I wonder if something along these lines could be contributing to more folk, you know, attending A&E rather than, and if they're not able to get onto NHS 24. I just wondered if you have any information as to why that number might have increased.
Chief Officer.
So thank you. I mean, we wouldn't encouraging patients to directly contact community hospitals. Certainly, there are opportunities for people to access care and treatment services, but those would tend to be coming through GPs, through NHS 24, and through triaging, just so to ensure that people are directed to the right services that are available. We have had some situations where people have contacted care and treatment services and they really should be going directly to accident and emergency. And we have other situations where people might contact services that could be better dealt with through an advanced nurse practitioner or through their local pharmacy. So there is a major strategic programme that the Scottish Government is advancing called Urgent Care. And with that, you'll perhaps have seen some of the media coverage about getting the right place, the right care at the right place at the right time. And there are very clear pathways that are available to ensure that people are being directed and responded to appropriately. NHS 24 may well be experiencing challenges at the moment. I think that's probably a consequence of what I was describing earlier in terms of the significant demand pressures that are being experienced across the whole system. But I really couldn't comment on the actions that they're taking in that regard. What we're not seeing is any evidence, as far as I'm aware, of any significant delays in people getting access to the treatment. And therefore then it would be difficult to draw conclusions that any failings in relation to the provision of community services could be impacting on the increased numbers of people presenting to accident and emergency. I suspect that anecdotally, and Chris may have a view on this or may have some data to support this, what we're seeing is as a consequence of the lockdown restrictions being removed, that people are out and about, they're having accidents, there's road traffic accidents, people are having falls, etc., etc. That is causing people to have to be seen at accident emergency more to a greater extent than what was the case previously. But Chair, you may wish to invite Chris Jolly to come in if he wants to add to that. Otherwise, I hope that that's provided Councillor Duff with a reasonably comprehensive response.
Okay, thank you, Chief Officer. I'll check with Mr. Jolly if he does want to add anything to that before we move to the next question.
Yeah, just happy, just very briefly, Chair. The one thing to bear in mind specifically in respect to the indicators as they're now presented is that the baseline has moved forward from 31st of March 2020 to 31st of March 2021 as a comparison. So this PI haven't had significant movement down the way throughout the 2020 year, and reported recently in respect to the APR has been quite low. We're now comparing this year against that very low point. So the increase in activity as the Chief Officer has suggested would certainly be, in my view, a valid explanation as to why we might see a movement upward from that very low base point last year.
Okay, no, thanks. Yeah, no, I think that makes perfect sense. So thanks very much for these responses. Thank you.
Okay, thank you. Right, we now have a question from Beth Hamilton.
Thank you, Councillor Purvis. This is more some clarity for myself and showing my ignorance as a new member. But Gordon, you talked about the falls and the readmission outliers. They are concerned about the way they are being calculated and recorded, etc. Are they similar to the way they are being calculated and recorded in the other IJBs, or is Perth different? Because I'm just wondering, I know these are KPIs for health in general, so is it a problem with the 3 different IJBs, linked back to Councillor Purvis' comment about sharing the information the way we collect it?
Thanks, Beth. Councillor Purvis?
I could just see that Mr. Jolly is wanting to come in, but if you want to start, Chief Officer, on you go.
Yeah, well, I just want to sort of give a high-level response to that, because I know that Chris Jolly is able to get into a great deal of detail about what is going on behind the scenes there. Certainly in relation to the readmission rate, Beth, our concern is how things are recorded I think Pantayside in relation to the inclusion sometimes of day appointments and outpatients being seen and classed as readmissions when they should not be, and that therefore skewing our figures. It is quite technical in relation to how patient numbers CAI numbers are then tracked, but some people who are recorded as having come back into hospital may just be coming back in for outpatient treatment, and the figures therefore then are not representative of what we might consider to be an inpatient readmission, and therefore then not consistent with how we understand other areas in Scotland report this. I don't have as detailed a response in relation to falls. We are concerned at how our performance is reflected in these figures, and we want to do two things. We want to make sure that the data is robust and valid, but elsewhere, more operationally, we are, as I've indicated, doing a lot of work around falls prevention, around mobility and balance, around supporting our care at home staff, independent sector providers who deliver care at home, for their staff to understand what they can contribute to ensure that their interventions are reducing the likelihood of falls from occurring. What we also don't know is whether this figure in relation to falls can in any way be attributed to people who we are working with or not, and we need to draw that distinction. But I will defer to Chris, whose thunder I may have stolen, but he can provide a little more detail.
Thank you.
Yes, happy to come in. Thanks very much for the question, and I think there's probably not an awful lot for me to add, specifically in reference to NI 14. The readmissions is a subject of a recent report to this committee, and as the Chief Officer's indicated, it's to do with the manner in which NHS Tayside record visits to hospital of certain types, and that is a fundamentally different way to how it's measured elsewhere in Scotland. So the comparisons to previous years are a better indication of the direction of travel than perhaps comparing to Scotland overall. I am aware of national work going on that will impact on the manner in which these figures are calculated, but I don't have the detail on that at the moment. It's not actually being worked through, and we'll happily update the committee on the effects of that at an appropriate time. In respect to falls, I think Chief Officer gave an indication earlier as well around the technical nature of the work that we're doing to try and unpick what sits behind this set of data, and again, we should bear in mind that the comparison to Scotland is possibly not as helpful as we might want it to be. If we look at our performance against last year, we have got a marginal improvement, and the comparison to Scotland means that we should be bearing in mind the significant demographic differences that Perth Kinross has in relation to our aging population by comparison to other areas of Scotland. So, we will continue that work internally, and we'll come forward with a report to the committee at an appropriate time.
Okay, thank you.
Thank you for that.
Is there a comparator we use in Perth Kinross at a similar population at all? Is it a family of benchmarking that we could use?
Happy to come back on that, Chair.
Mr. Jolly.
Okay, thanks.
So thanks very much. There is some work ongoing in that regard as well. It was a point that's been raised before. I think Ms. Kilpatrick raised it particularly previously, and we've been working with our colleagues in Public Health Scotland to try and establish those areas that would be a better fit in terms of our demography, and again, that work is ongoing, but seeking to get better comparators is always a constant challenge, but we will certainly endeavour to do so.
Okay, thank you for that.
Okay, thank you. Were there any further questions on that report? No. Can I invite any comments on the report? Okay, well, we are asked to note the Health and Social Care Partnerships performance for the first quarter of the year. Can I take it we're happy to agree to that? I'll take silence as yes. Okay, moving on to the next section of the agenda, which is governance and assurance. And the first paper is item 5.1, and that is the strategic risk management update. Now I'll ask the Chief Officer to introduce this report.
Thank you very much, Chair. I'm happy to present this report to members of the Audit and Performance Committee. This report provides an update on our strategic risk register. Those are particular risks that at a high level and impact on the Health and Social Care Partnership's ability to advance the IGB's strategic priorities. This report provides an update in relation to the risks that you will be familiar with, having received reports on the strategic risk register previously. It introduces a further risk, which I'll speak to, and it identifies the progress that we've made both in relation to the executive management team's routine reviews of risks to determine whether there are any changes in the risk rating, but also the improvement plan that we've developed that seeks to achieve some of those changes in the risk rating by taking forward the necessary actions to mitigate or control the risk. Members of the Audit Performance Committee will want to look at Table 1 on page 40 of the papers. Essentially, this reflects that in our most recent review of risks, we have not identified any material change in relation to the risks that we reviewed on that occasion. But you'll see at the bottom of that table, the strategic risk 14 has now been introduced. This is a new strategic risk that recognises challenges in relation to the provision of premises. As we've indicated in section 3 of the report, this pertains to staff who are at risk of displacement because of changes in the way in which premises and accommodation is being managed. It relates to staff who are not suitably accommodated in the current accommodation and premises, and it relates to the expansion of some services and the developments that we've advanced in the course of the last 18 months, which has brought on stream new services and new staff and a need for them to be suitably located. So that risk is now incorporated into the appendices, both in relation to the Strategic Risk Register itself, Appendix 1, and at Appendix 2, the Strategic Risk Improvement Action Plan is there for members of the Audit and Performance Committee to consider. So I would just reference the fact that we have looked as members of the executive management team at what opportunities are available to us to control and manage and mitigate the risks, and we are still in a position where we have a number of risks, strategic risks that are high priority, a number of strategic risks that we're managing effectively, and some obviously in between. So members will want to reflect on this because it does have a bearing on the ability of the Health and Social Care Partnership to advance the actions necessary to secure the delivery of the IGB's strategic commissioning priorities, and we'll want to consider whether or not there are further actions that you can identify that we need to take in order to improve the position, and if not, what level of risk appetite, and this is why we're going to be having the further development session specifically to look at risk appetite, the IGB is willing to tolerate. Thanks, Chair. I'm happy to take any comments on this or questions.
Okay, thank you, Chief Officer. And just to add my comments to welcome the introduction of the risk relating to partnership premises. I know this is something that has been raised on a number of occasions by Mrs. Kilpatrick in particular, and I hope that she would be reassured about its introduction, particularly the improvement action that relates to accommodation strategy for the partnership, as I know that's something that she raised, and I'm sure she'll have comments on that at a future meeting. But good to see that that has now been included. We'll move on to questions now, and I can see that we have a question from Mr. Benson, so we'll start with that.
Thank you, Chair. I'd like to ask about Strategic Risk Register, page 44, Social Care Market Conditions, number 6. Obviously, this is a very difficult area because we're dealing with external providers. Do we know or have any indication of what the growing pressures on the workforce availability are likely to be, and if we're seeing more staff leave due to more attractive wages on offer elsewhere? This would strike me as being a key issue for us. I wondered if you can update us on that. I notice it's a priority 3 grading at the moment.
Chief Officer.
Yes, thank you, Bob. Thank you, Chair. I may bring in Zoe Robertson in terms of some work that we're taking forward, and also to give an up-to-date position in relation to the pressures that we're experiencing in Perth and Kinross. Inevitably, this is a matter of concern because I would remind members of the Audit and Performance Committee that in relation to the provision of care at home services, we outsource the majority of those services from independent sector providers, and we don't have our own in-house service, although we are looking at how we might develop the work of heart and think about how we might develop some capacity so that we're not as reliant on the independent sector, who, as Bob has rightly pointed out, are continuing to experience staffing pressures, and that results in challenges for us, particularly in relation to the provision of services to more rural and remote areas where recruitment challenges are much more acute. Members of the Audit and Performance Committee will recognise that in the last week or so I've issued to IGB members a briefing that talks about how we are looking to develop care at home resilience, and that's around how do we ensure that we have that sustainability and capacity from the independent sector, but what are the other models that we might wish to innovate to build community capacity and to work in local areas with local people, particularly around the health and care cooperatives, in order to ensure that there are other ways in which services can be secured and delivered in a way that makes them much more sustainable. Certainly, we've seen challenges in relation to the provision of independent sector care staff in recent months with the relaxation of lockdown, and the reopening of the hospitality sector has enabled people to have different choices in terms of employment. We, as mentioned earlier, are also experiencing challenges in relation to independent sector provision as a consequence of the demand pressures and some of the staffing absences that I've alluded to. Zoe may wish to come in, Zoe Robertson, who oversees our work in relation to contracting and commissioning, in relation to what we're currently seeing and what challenges we're currently experiencing in this regard. Zoe, I'll hand over to you, please. Thank you.
Hi, yeah, I mean, Gordon's articulated that well there with regards opening up of hospitality, and that's where we're seeing a lot of the pressures, particularly in relation to care at home, and people returning to the hospitality industry, seeing that as preferable to the stress and strain that's been caused by a sustained response to COVID. So we are definitely seeing pressures within, I would say, all of our health and social care delivery, not just care at home. Care homes are also struggling, particularly in relation to recruitment of nursing staff. So I think what we're experiencing is an overall fatigue within the social care workforce. And as Gordon says, we're doing all we can in terms of that external provision to support them by looking at community collaborative approaches. So the first meeting was last week, and there were one for each locality, gathering together stakeholders from each area to discuss what they think would work best in their local communities. So trying to tackle both rural and urban provision. Urban issues are less of an issue for us, the rural issues are more of an issue. And so not just, as Gordon says, relying on statutory services, but looking at what we can do with the voluntary sector, what we can do with other third sector providers, what we can do with option 1 provision, for example, through the Care and Wellbeing Cooperative, or through what we're doing at the moment through Support Choices, which is enhancing community brokerage, meaning that people who need services have the intervention at a much earlier stage, and the hope is that the level of service that they require will be less than we're experiencing at the moment, because as alluded to earlier on, people that are coming forward at the moment are much more complex, and so the packages of care that they are requiring are much larger, which is meaning that those pressures are greater again. So there's lots of little pieces of work that are coming together to try and alleviate some of that pressure that's being experienced at the moment.
Thank you for that. I know the Chief Officer wanted to come back with a brief comment, and then I'll come back to you, Mr. Benson.
Thank you.
Thank you very much, Chair. So yes, I mean, locally we've got our activity around market facilitation, around engagement with the sector, around care at home resilience, around innovative new models. But it would probably be remiss of me not to recognise that some of these challenges are the challenges that have led to some of the proposals being brought forward through the independent review of adult social care and the proposals around the National Care Service. Now, the important thing there for me is to recognise that that has escalated onto the national stage, a recognition of the contribution and the value of social care and the need to invest in those services, the need to invest in the workforce to ensure that this is an attractive career option for people, and that staff who come in are able to be supported to be confident and competent and remunerated and supported to carry out what is a really important task. I think it is encouraging that that probably is born of a recognition that care at home services and community services are effectively the cornerstone of community care and make a significant contribution to reducing the need for people to be admitted into acute hospital. So it is important that we recognise that strategic context, and it's important that we make sure that we optimise the opportunities that are going to come from the national work around the increased recognition of the value of social care. Thanks very much.
Chief Officer. Mr. Benson, did you want to come back?
If I may, in terms of the priority rating of this risk, and given that you've made a clear split between urban and rurality, should we be reviewing that perhaps in terms of the rural issues, which we know are the ones that are most pressing? And I simply ask the question that perhaps should we review the 3 priority rating it currently has?
Chief Officer.
Yes, that's a very valid suggestion, and I think we should consider it. I think some of the difficulties around aggregating these risks are that we then lose sight of some of the particular areas of difficulty or challenge. That's not to say that we don't have a different set of challenges in relation to the provision of services in the city, but your point's well made, and we'll take that offline and apply that challenge to the current risk rating and consider whether or not we need to bring forward a revised version of it.
Grateful for that, thank you.
Okay, thank you, Mr. Benson. Can I ask if there are any further questions on the risk register? No? Are there any comments? Okay, I'll just make one further comment. I alluded to the workshop we had a little while ago, which I thought was very useful. I think there is still some work to do to determine exactly how we should escalate risks, both ones that are highlighted in the register, and how we get assurance that there's a proper process in place to ensure that the committee are aware of those, and if there is something that is escalated to the committee, how we determine exactly the actions that might come out of that. And that's perhaps something that we can touch on as part of the risk appetite workshop, as well. As I note that there was an offer from the head of legal and governance from the council and other officers to have a further discussion around that, which I think would certainly be helpful for me, and I think other members too. So just to summarise, we are asked to note the strategic risk register and the strategic risk improvement plan, note the current position of the IGB strategic risk exposure scores as set out in section 2 of the report, and also note the inclusion of the new strategic risk that we both alluded to earlier on in relation to the partnership premises as detailed in section 3. Can I take it the members are happy to note those points?
Agreed.
Agreed. OK, thank you very much. Right, moving on to item 5.2, which is the Partnership Improvement Plan update, and I'll again invite the Chief Officer to introduce this report.
Gordon, are you happy for me to take this report?
Yes, I think we'd agreed that. I was going to say that, Chair.
Apologies, I was just going by what I said on the agenda, but that's fine if the Chief Financial Officer wants to take this one.
Thank you, Chair. Yes, the update provided to members on the Partnership Improvement Plan demonstrates further good progress since the last report. And I'm actually going to hand over quite quickly to Fiona Lowe to provide an overview of the key areas of progress and some areas of slippage. Fiona, if you'd like to update the committee, thank you.
Thanks, Jane. Just to note that there are 6 actions which have been completed since we last reported. These are noted in the paper. So things around terms of reference for the communication and engagement group have been refreshed, and there have been meetings have been diarised to align with the strategic planning group. We now have regular systematic review and reprioritisation of programme and project management resources across our priorities. Meetings have been set up with finance colleagues across NHS, Tayside and Perth and Kinross Council, and these are held regularly. Local participation and engagement plans are in place, overseen by locality management groups, and regular locality updates will be brought to this committee in due course. Health and safety and risk have now been added to agendas as appropriate, so things are moving forward from that perspective. 2 actions have moved from green to amber, and that is number 13 due to the market facilitation plan being delayed, and number 26, which is around capacity issues for officers to take forward integrated budgets, particularly in relation to older people, just in the continued pandemic response. 6 actions have revised timescales. Action 4 and 5, I am pleased to report, are now complete. These were in relation to the Chair and Vice Chair of the IGB having their annual development sessions with members. These have now been held. 7 and 9 are around the communication and engagement and participation group, which meetings are planned to be set up for this month. Number 13, as I said, the market facilitation plan has been delayed. And number 32 is around the process for directions. We are reviewing papers before they go to committee to check that if directions are required that this happens. However, the final process is still being worked on with legal colleagues and should be in place early October. The only other thing to note is there is changed wording around 2 actions. So number 16 now references strategy groups and the strategic planning group, which reflects the change in governance arrangements. And action 22 was split across 3 separate areas, and this is around the workforce plan, the development of the 3-year plan. This incorporates organisational development and the use of technology, so this has been merged into one action. that's a very quick whistle stop tour, so I'm happy to take any questions, Chair. Thank you.
Okay, thank you for that. That was very comprehensive and hopefully helpful for members. Can I ask if there are any questions on this report? You might be getting easy there. No questions. Okay, any comments? Okay, well, thank you for that, and it's very welcome to see some good progress in the Partnership Improvement Plan, and we'll look forward to the next update at the next committee. And just very briefly, we're asked to note the progress towards the achievement of the actions within the Partnership Improvement Plan. I take it that everyone is content with that. Take silence to mean yes. Okay, great. Thank you for that. We'll move on then to item 5.3, which is the audit recommendations update. And I hope I'm getting it right this time. I'm going to hand over to the Chief Financial Officer to introduce this report.
Thank you, Chair. Again, a full report on progress in implementing audit recommendations is provided to members today. This sets out further good progress with only 2 recommendations not yet implemented. Both of those relate to the review of organisational restructuring, and Gordon may wish to comment on some of the challenges in this regard.
Thank you. Chief Officer.
Thank you, Chair. Apologies, there was a lag in my camera coming on. Yes, so members of the Audit and Performance Committee may well be aware, or I can advise that there has been a proposal around the restructuring of the Health and Social Care Partnership for some time. It is something that hasn't been able to be progressed as a consequence of our focus on reacting, responding and recovering from the pandemic. I've recently began again to look at what actions we might bring forward, the ambition being to seek to try to deliver a much more integrated way of working rather than the current aligned structure where we have a health line and a social care line. I've had some engagement with the executive management team and also with the trade unions and with colleagues in HR in both Perth Kinross Council and NHS Tayside. There will be significant work required to advance the restructure, and whilst we are in the throes of restructuring, there are challenges around our ability to fill existing vacancies. I'm thoughtful about that and thoughtful about whether or not the existing commitment to advanced restructure needs to be refined and revised in light of that. And I'm also thoughtful about whether or not the time that it would take to get to the second and third phases of restructure, because of the organisational change policies and procedures that we need to move through, starts to take us too close to the imminent, by then, National Care Service to justify that activity. So what I need to do is to reflect on all of that, to have discussions with colleagues who would likely be affected, to take the views of colleagues in HR and the trade unions, and determine whether or not there is a need for a full restructure or an opportunity for us to refine our existing structure in a way that is not as radical, not as time consuming and labour intensive, and not going to take as long to do. So that's something that I need to advance. It has only recently been something that's come into my thinking because I've become increasingly aware of these external factors and influences, and the length of time that it might take to achieve the outcome that we would be looking for. So I'll be reflecting on that, taking advice and discussing with statutory partners what implications that might have. I'm conscious then that if I'm going to change our approach and come back with a counter proposal, that that has a bearing on some extant audit and inspection recommendations, and will be of interest to the Audit and Performance Committee as a consequence of that. So let me come back in due course with an update, if you would, Chair, because there are now risks of restructuring that weren't there previously, that might need to be balanced against the risks of not restructuring and the opportunities that it could bring. So I'm probably looking at a middle ground that enables us to very quickly get the capacity and the staffing issues addressed, and try to work more effectively without necessarily embarking upon a lengthy and formal procedure. But obviously given due regard to the need not to do anything that's to the detriment of the terms and conditions of our employees, who are key to all of this, and are probably also very keen that we make something happen sooner, rather than take some considerable time to deliver something more comprehensive. Happy to take any questions on that, because I'm appreciative of the fact that some members of the Audit and Performance Committee will know that this has been around for some time, and may well be challenged that I'm considering taking a different approach, but hopefully I've assured you that that's for good and sound reasons.
Okay, now I think that Mr. Benson is probably going to want to come in with a comment on this. If I can just reiterate in public forum what I said when we discussed this briefly at a previous meeting. You know, clearly my ambition, and I think the ambition of the Integration Joint Board when this was discussed before, was that we do move towards a more integrated structure, and I think that's something that we should all hope to you know, have as an eventual goal. But I do appreciate that there are a number of changing factors, particularly around the possibility of an entirely new structure, and clearly the primary aim is that we have staff in post in order to deliver the services. So that should be the primary goal, and then any restructure could come after that, should, you know, circumstances allow. But that's my initial view at the moment. But clearly we'll look forward to seeing any proposals that you do bring forward. I'll bring Mr. Benson in because I'm assuming it's on this before I invite any other questions.
Thank you very much. It was exactly on this, Chair. And I was just going to ask, Chair, that when you do your verbal update to the next IJB meeting, I wonder if you could perhaps just reiterate exactly what you've said to the full IJB as part of your assurance reporting. I think it's really such a key issue that the full IJ needs to be cited on this, and we need to do everything we can to assist the Chief Officer and his team to make this work for him in very changing circumstances. Thank you.
Okay, thank you, Mr. Benson. I just wanted to add, before I invite questions on action reference number 63, yes, it is 63, isn't it? Which was about the various risks that were involved with the partner organisations, as long-standing and complex actions had not been resolved in certain areas. Just to update, I have had a meeting with Councillor Duff, with one of his other hats on as Deputy Leader of the Council Administration, in relation to a number of those issues, such as the review of the integration scheme, the risk sharing agreement, corporate support, large hospital set aside, the joint workforce arrangements and clinical care and professional governance assurance, which I hope was helpful for him. I do hope to have a similar meeting with the chair of NHS Tayside. I have written to her in this regard, and will go back to her offering some times. So it was just to say that we are continuing to press the case. I know that things are further complicated by some of the changes that are being proposed nationally, but I have had assurance from the Chief Officer that there is still an expectation that the integration scheme is reviewed in the near future. So I just wanted to pass further comment on that. Councillor Duff, were you wanting to make any comment on that? I saw you put your camera on.
It was just to confirm that it was very helpful, Chair, thanks very much, but also that since we met, I have passed on the details and briefed the Leader of the Council on the issues that we talked about.
Okay, thank you very much for that. I'll invite any questions on this report. No. Any comments other than those that we've already had? Okay, well, we're simply asked to note the progress that's been made to date on implementing the agreed audit recommendations. I take it we're all happy with that. Okay, right, moving on now to item 5.4, which is the internal audit progress report, and I'll invite the Chief Internal Auditor, Jackie Clark, to speak to this report.
Thank you, Chair. This report provides an update on the progress with internal audits work with regard to the IJB, but I've also taken the opportunity of adding a couple of other sections into this report. Regarding the progress with plans, we have one audit which is in progress at the moment, which I would anticipate would be reported to the next meeting of this committee. And we've had discussions regarding the two reports from the current year's plan, which will be brought to future meetings. We've had discussions about the timing of those, and the anticipated reporting dates have been captured within the appendix to the report. This is partially dependent timing-wise on recruitment activity which is taking place within Perth Kinross Council internal audit team. So we are recruiting at the moment, and that will facilitate the completion of those two audits. Section 3 of the report is recommending some performance indicators for internal audit, which could be quite useful for this committee. The first one being that the internal audit service undertaking the work should be externally validated as compliance with the public sector internal audit standards. As the committee will be aware, both partner internal audit functions are required to be compliant with the public sector internal audit standards to fully undertake their roles. And this is something which is undertaken every 5 years as an external validation of compliance for both organisations. And I've put there that performance indicators should be that both are fully compliant. There are levels of compliance: fully compliant, and partially compliant, and not compliant. And I would envisage that you as a committee would want full compliance, and I've put that as a performance indicator, a recommended performance indicator. The other two performance indicators that I have suggested are that reports are available for consideration at the Targeted Audit and Performance Committee, and that assignments are complete in order for the Chief Internal Auditor to provide a timely annual report and internal audit opinion at the end of year. Obviously, this is dependent, the completion of the reports is dependent on both parties being able to undertake the audit activity. But I think that these are useful things which will flag up any issues regarding internal audit service specifically, or regarding the partnership's engagement with internal audit, which may be of relevance and of interest to this committee. The final section of the report, section 4, is something which I think is really important. We have a report sharing arrangement where reports of relevance to the IJB that have been considered by partner bodies are brought to the Audit and Performance Committee. As part of my review of both Perth Kinross Council's internal audit plan and also the NHS Tayside internal audit plan, I've identified 7 areas there which may be of relevance to the IJB. So as part of my routine work as Chief Internal Auditor, I will review the outcomes from these particular audits and see whether there's any relevance with a view to bringing those reports to this committee for noting. I'm happy to take any questions or comments regarding this report or its appendix.
Okay, thank you very much for that. And in particular, I'd like to welcome the work on the indicators, performance indicators, following on from previous discussion at previous meetings of this committee. So I think that's very useful to have a means by which we can measure performance in that regard, as we would do in other areas. So thank you for that. And also, it will be good to have those reports flagged up from our partner organisations, where that has a bearing on the work of the partnership. And there's a lot of things that are, as this new way of working develops, that we need to get used to. But I think that is a good development, and hopefully that will give us further assurance on some of those shared services that you've outlined in that section of the report. So I'll invite any questions on this report. Don't see any questions. Any comments? No comments. Okay, well, the recommendation is that we note the progress made in the delivery of the 2020-2021 and 2021-2022 plans, that we agree the performance indicators as described in section 3 of the report, and that we note the outcome of the review of the internal audit plan for the council in Perth Kinross and also NHS Tayside in section 4. We're happy to agree those recommendations.
Agreed.
Okay, thank you. Thank you, Chief Internal Auditor. Oh, I've accidentally muted myself. Okay, right. If we move on now to section 6 of the agenda, which is the audited annual accounts for 2020-2021. And the first item we have here is 6.1, which is the assurances received from partners. And I'll ask the Chief Financial Officer to speak to this report.
Thank you, Chair. As members will know, the effectiveness of the IGB's governance arrangements relies on there being appropriate systems of internal control in place within both partner bodies and within Angus and Dundee IGB. I'm therefore pleased to bring forward assurance for 2021 from all parties, and that's set out in the report. The exception to that is in relation to Dundee IGB, where a delay in the undertaking of the external audit in Dundee means that full assurance will be brought forward to the next committee. However, at this stage, no issues in terms of the effectiveness of governance in Dundee are anticipated. I'm pleased to bring forward specific assurance to the committee in respect of NHS Tayside arrangements for effectively managing and monitoring clinical care and professional governance, and that's set out as an appendix to the report. Finally, and following confirmation by our external auditors as to the effectiveness of Perth Kinross IGB's governance arrangements, letters of assurance have been provided to NHS Tayside, Perth Kinross Council, and both Dundee and Angus IGBs from the Chair confirming the effectiveness of our arrangements for 2021. I'm happy to take any questions.
Thank you for that, Chief Financial Officer, and it is particularly welcome to see the inclusion of the report in relation to clinical care governance. And I note the amendment to the annual governance statement following on from the previous consideration of it at this committee. And I know that there are still ongoing discussions about how exactly the future reporting of clinical care and professional governance, both from the NHS and the Council, will come to the Integration Joint Board, but it is welcome as part of this assurance statement that we do have that included. I'll invite questions now, and I think we have Mr. Benson first.
Thank you very much indeed. It's quite a comprehensive report, as you would expect. Just simply, I'll just have to go through them for you, some of the areas. Page 115, financial management, in the conclusion box. The last paragraph states that there is no strategic planning capacity, which is also mentioned elsewhere in the papers. Should we be stressing that this gap needs to be filled soon, and by when? and I merely make that as a kind of question or statement. And
sorry, Mr. Have you moved on to the accounts themselves?
No, I'm in the page 115.
Oh, perhaps my numbering is slightly different from yours. Okay, on you go, and I'll try and find mine only goes to 110, 1110.
Oh, okay. It is a bit about strategic planning capacity is mentioned in the conclusion box. Can we maybe be stressing this gap needs to be filled soon in the sense of giving it some urgency, and by end of the year perhaps, question mark. I mean, I immediately raised that as a point, and maybe Jane might want to come back to that. I think there are one or two others I'd like to ask as well, if that's okay, Chair.
Okay, thank you for that, Mr. Benson. Chief Financial Officer, do you want to address Mr. Benson's question?
I think I would defer to Gordon in relation to strategic planning capacity, although I'm struggling to see the reference within the paper, but I'm sure Gordon would be happy to comment.
Okay, Chief Officer.
Yeah, it's been unable to locate the particular section in the papers. My supplementary agenda and papers only got to page 110, but I can make comments.
Councillor Duff, were you going to helpfully tell us where it is?
Yeah, well, I think Mr. Benson has skipped on to 6.2, to be honest with you. And
I apologise, Chair. He's absolutely correct. I have done. It's the small script. Sorry about that.
Oh, right, okay.
It's okay. 6.1's in the supplementary pack, Bob. You have to switch to the other.
That's exactly what's happened, John. Thank you.
Okay, yeah.
Right, okay. We'll come back to that then. Is that all right? Can I just check first, are there any questions on the assurances received from partners? No. Okay. Are there any comments on those assurances? No? Okay, well, if I just quickly go through the recommendations, we are asked to note that the IGB has issued confirmation of the adequacy and effectiveness of the governance arrangements in place within Perth and Kinross IGB for 2020-2021 to NHS Tayside, Perth and Kinross Council and to the two other Tayside IGBs. To note the position regarding the confirmation of the assurance from NHS Tayside and Perth and Kinross Council. Note the position reconfirmation of the assurance from Dundee and Angus IGBs. Note the specific assurance from NHS Tayside in relation to clinical care governance. And note that the status of assurances from NHS Tayside, Perth and Kinross Council, Dundee IGB and Angus IGB is consistent with the contents of the IGB's annual governance statement in the audited annual accounts. Are we happy to agree all of those recommendations?
Agreed.
Great. Okay. Thank you. Right. Well, we'll now move on to item 6.2, which is the audited annual accounts. And Chief Financial Officer, are you going to start with the introductions here?
Yes, thank you, Chair. Can I just start off this part of the agenda by noting one error in the report on page 97 at the end of section 2. This should read that the final sentence, the Audit and Performance Committee are asked to approve the letter of representation at Appendix 3 for signature by the Head of Finance and Corporate Services. So apologies for that error. It's now consistent with the final recommendation made at the end of the report. I just wanted to note that for the record. So On the 21st of June, the Audit and Performance Committee approved the unaudited accounts for 21-22 on behalf of the IJB. And the audit of the accounts has taken place between July and indeed right up until September 2021. I'm delighted that Michael Wilkie from KPMG is here today to take you through the key findings which are set out in the annual audit report circulated. I'm going to hand over to Michael to take you through his findings.
Okay, thank you. Mr. Wilkie.
Thank you. So I'll continue to reference your PDF document page numbers. This is our annual audit report, so setting out the conclusions, having reached the end of our final audit fieldwork, and we did previously present a strategy setting out the planned approach. The executive summary is where I'll start, which is on page 102, and that's my document, page 3. And most critically, I intend to issue an unqualified audit opinion, having completed our work in respect of the accounts and their compliance with the relevant standards. At the outset, I identified that we accepted the presumed risk that exists in all audits, that management is able to override controls to commit fraud because of their unique position within an organisation. Having completed our testing, including of journals and of unusual transactions, I'm satisfied that there are no such instances. There is also a second presumed fraud risk which could exist in all entities, and that's in respect of fraudulent income and expenditure recognition. But due to the way the costs are incurred by partner bodies, we rebutted that risk. However, our testing of income and expenditure has also been satisfactory. I also note in the right-hand box there that having considered management's assessment, I'm satisfied that the IJB continues to be a going concern, notwithstanding the fact that under the accounting code, the IJB is required to prepare its accounts on a going concern basis unless there's an intention to wind it up. I'm otherwise satisfied that it has sufficient financial plans and ability to continue as a going concern. We've given over a number of pages of the report to assessment of the financial outturn in the current year, including understanding the overspend, which is largely as a result of additional COVID-19 grants and funding, as well as delay in delivery of some other services and underspend on operational budget. We've also given consideration to future financial planning, including the one-year budget for the year we're in at the moment and the planned move back to 3-year budget setting in the future. And the last thing on financials I'll just touch on is that we have recognised the significant increase in debtors at the year end as a result of additional funding held by the partner bodies on behalf of the IJB. If I move on, there's a number of specific conclusions on page 107, and importantly I would just note that having completed our audit, there were no audit adjustments, and that is significant. So there were no adjustments made, and there's no unadjusted differences, so we didn't identify anything. Management provided us with accounts in line with the timetable we expected. They were well prepared, and other than some minor presentational points and feedback, there was nothing to be changed in those. From page 113 onwards, we covered a number of matters around wider scope. But what I might just do, rather than going into that in detail, is turn to the recommendations, which are towards the end of our report. And these are largely consistent with the previous year, and in fact an update in terms of management's response and our understanding. So the first of those is just noting that the IJB has a reserve strategy, but there continues to be a need to move to having a clear plan as to how that strategy will be achieved, and that should be aligned with the longer term budget setting process, so to move towards that 2% of annual spend as a reserve, and I think the uncommitted reserve currently stands at around 0.5%. The second recommendation, page 127, we have made consistently for a number of years, is our recommendation that consideration is given to moving to proportionate risk sharing. As we know, that's likely to be considered as part of the ongoing review of the integration scheme, but there is no decision being made yet. And the third being a point that's been touched on previously around strategic and corporate planning capacity, I think it's fair to say that I recognise that the challenges facing the IJB are quite extensive. I obviously have a focus on financial matters, financial management and financial planning, and I would recognise that it is a challenge, given the limited number of officers within the IJB, to actually step back and strategically think ahead. We have noted, however, that the workforce plan was prepared and submitted, and so really it is now about building on from that and filling those positions, as was touched on. I wouldn't intend to say much more. The audit's complete. We have no findings and no adjustments, so nothing really else to add.
Okay, thank you very much for that, Mr. Wilkie, and certainly on those recommendations again, it is very useful that you continue to highlight it. I think it's frustrating for all of us that we have not yet been able to deliver on some of those recommendations that have been coming up for a number of years now, but certainly this will provide us with additional leverage to put that to our partner organisations and try to find some kind of resolution, particularly given the assurance that we've received that the integration scheme still does need to be reviewed regardless of any changes that might be happening at a national level. So we will continue to make the case in that regard, and thank you for continuing to highlight that in your report. Chief Financial Officer, were you wanting to come back in? I saw you put your camera on.
Yes, unless there's questions at this point, I really just wanted to point members to the audited annual accounts for 21-22, which have been circulated, and they're now asked to approve along with the letter of representation. Just before passing back to you, Chair, to fulfil that, can I take this opportunity to pass on my thanks to Donna Mitchell and the finance team, who worked again in extraordinarily difficult circumstances to meet very difficult deadlines. I would like to thank KPMG, to Michael and to Chris and the team for their constructive and supportive approach, and again a very further challenging year, and again to the PKC design team, who to very tight deadlines have produced what I hope is a very user-friendly set of annual accounts for 2021, and helps by taking that kind of user-friendly approach to fulfil the aims of being open and as transparent as possible with the users of the accounts. And having said that, pass back to you, Chair, to conclude.
Okay, thank you for that, and I'm sure I speak for the whole committee in saying that I'm very happy to reiterate those comments. The accounts certainly that are prepared by Donna and the team are always, I find, very clear and very readable, and certainly easy documents to use, but get across the important information that we need to see. So that's very welcome. I will ask if there are any questions on any of the documents that we're considering, either the accounts themselves or KPMG's external audit report. Mr. Benson, do you want to come back to your
thank you, Chair.
Points.
Thank you, I appreciate that. And again, it comes back to page 1. I think I'm on the right page this time, the right document.
It's 115.
I am a mere humble proxy, I have to say. Right. Okay, thank you. It's very specific. There remains no specific street planning capacity, page 115 in the conclusions, with the IJB to inform and lead senior street planning capacity. It's a pretty bold statement, and I can't disagree with it, but there is any way we can, could that be modified in some way, that the gap needs to be filled in some time, or there's some kind of mitigation that we're taking, and that may not be possible within the terms of this report. But there's also a bit on page 120 about where it's another kind of bold statement about membership. This again in conclusions, membership of the IJB remains unstable, and then it went on to say a bit more about potential upcoming elections. But what would be the definition of unstable? I suppose these are my two questions.
Okay, well, I suppose these are two questions for Mr. Wilkie.
Yes, so the first question around strategic planning capacity, I would be content to add some context around the work that's been done on workforce planning, and I suppose also to reflect the fact that it seems apparent to me that members are aware of the need to enhance strategic planning capacity, so if that would be a useful context to add, I could put that into the report.
Thank you.
In respect of the second part, I think unstable is a word that we, I think, used in the previous year, and it was referring to the changes in membership of the IJB, and really the challenges that brings around new members and getting up to speed, understanding the IJB and its business, and then being able to take strategic decisions.
Right, I just didn't quite know about why it would need to be unstable, because we're no more different from any other integrated joint board in terms of the use of proxies and others to make such changes. So I'm just curious to know the definition of it. That was all.
Let me reflect perhaps on the word unstable, and we can be more specific.
Thank you. I'd be grateful for that if you could. Thank you.
Okay, thank you for that, Mr. Benson and Mr. Wilkie. I think it's something that's been raised in previous years before, and I think even going back to the start of this council term, there were concern that the number of changes were perhaps more than had happened in other areas, and I know that I have made the point certainly that in relation to council appointments, they are essentially political appointments at the end of the day and matters for the council, but that perhaps the churn had been more on this IJB than it had been in others. But Mr. Wilkie, thank you for taking that away to reflect on. Any further questions on either of these two papers? No? Okay. Any comments then? No? Okay, right. Well, we'll go through the recommendations, and Chief Financial Officer, you can keep me right, because I know you said there was... Oh, sorry, I've seen there's a comment from Councillor Duff, so we'll take that first before we go to the recommendations. Councillor Duff.
Thank you, Chair. No, it was just simply, I think, on behalf of the board members to reflect on the amount of effort and time that our own finance team and the auditors have put in to get the accounts and the report prepared. I'm sure we come along on a day such as today to consider it. But it's the culmination of many hours of work by all these parties, and I think we just need to officially record our thanks as board members to everyone involved in getting it done and approved, and it's a very good report, albeit there are some long-standing issues that we just don't seem to be able to make much headway with, but by and large the accounts and the reports before us today are excellent, and thanks to everyone involved.
Okay, thank you, Councillor Duff, and as I said earlier, I'm sure we can all agree with those sentiments, so thank you. Right, if we consider now the recommendations, we're asked to note the contents of KPMG's annual audit report to members of Perth Kinross IJB and the Controller of Audit on the 2020-2021 audit. We're also asked to approve the audited annual accounts for 2020-2021 and approve the letter of representation for signature Chief Financial Officer by the Chief Financial Officer, am I right? Is that what it was to be?
That's correct. Yeah. The recommendation is correct, yeah.
Okay. Great. Right, that's fine then. Are members happy to agree those recommendations?
I'm happy to agree those recommendations.
Agreed.
Agreed. Okay, thank you very much. Right, if we move on to the next section of the agenda, which is simply for information, we have the Audit and Performance Committee work plan for 2021-2022 at 7.1 and the Audit and Performance Committee record of attendance at 7.2. Are there any comments or questions on either of those two papers? No. Okay, can I ask members whether they would like to have the opportunity for a private discussion with the auditors, either the internal or external auditors?
Not required from me, thank you.
Me neither.
Okay. No. Okay. Right. Thank you very much. Well, that concludes the business today. The next meeting is on the 13th of December. Can I thank everyone for their attendance and contribution today, particularly those who are substituting, including at short notice in one case. So thank you very much.